Heel pain is one of the most common things we see. It can be caused from an injury, so you may be falling from a height, or more commonly it tends to be a gradual onset type issue where someone might have a little bit of pain in the heel, they might not even be so much aware of it, and then it gradually gets worse with time. So first step in the morning, it's often sore. Late at night when you're home from work, it's sort of after you've sat down for a while, it might become sore as well. Heel pain is an interesting one as well. When we look at the way the foot works, we have your gastroc muscle at the back, your calf muscle. It comes down through the Achilles tendon, will attach into the bone of the heel, into the calcaneus, and then we look on the other side. So we get attachment here, and then underneath the heel we get the attachment of the plantar fascia as well. So there's a transition load point. As we walk through, we strike at the heel and we move it forward, and that force from when you stand or from when you walk is translated through, and so there's a lot of pressure moving through this part of the foot every time you walk, every time you stand, every time you jump, whatever you're doing. We need to think about in context of, as we doing different activities as well. We might be moving house, for instance. The box that we hold when we're moving house, that force from the box, that weight is translated through, and so the heel needs to deal with that. And so often we find these issues are related to how that pressure, how that force is applied, and then there's usually a correlation with an increase, a dramatic increase in pressure applied through there. Yeah, so with heel pain, there's a whole range of things we can do. First off, we probably need to be more or less sure about which area we're treating, because there's a lot of different conditions that can occur within that small space of the heel. So often we'll send you for an ultrasound. We may send you for an MRI if we need to as well. X-rays may become part of that also. But we want to be sure about what's the cause issue there, what the areas are. We'll also have a look at you walking, have a look at the alignment, the way your foot works when it's being used. And often there's a discrepancy there. So there might be something where the foot's rotating too far one way or the other. There might be a range of motion issue. There's all sorts of things that come up, and we'll come up with a plan from there. So it may range from something to do with, we can look at sort of non-invasive soft tissue treatments like shockwave, and it involves using a machine, which is this. We're able to apply ultrasound gel to this, and then it sends the sound wave in through and stimulates the area to start to heal. And so that's a really good way that we can initiate the healing process. So these areas often are very slow to start healing, and so this just gives us that little bit of advantage in terms of getting it moving in the right direction. We can also look at custom orthotics as well is often a big part of this too, because we want to look at it from the long-term perspective in terms of, let's offload the area, let's neutralize the forces that are causing it to become sore, but then also let's look at making sure that doesn't come back. So the best thing we can do is try to develop something, especially if we find something with the way that you're walking, we can develop something to really stop that and treat the long-term cause, and that's the goal. That's really what we're all about. So we can do short-term treatments like this, you can do long-term treatments, and we can also look at things like, issuing cam boots, like moon boots like this can be really effective in terms of reducing that pain first off as well. And so there's a whole range of treatment options that we can look at, and it's really about making sure we see you, make a decision, get the right information, and then make the right call on how to move forward.